Hello, this is Sheila Harrison coming to you from the EBC meetup for October. Today we're featuring Travis Middleton, who is with Trademark Insurance Agency, and he's going to talk to us about the new Obamacare rollout and whether it's going to be a train wreck or an express train for you and your company. We have these meetups every month and we invite you to join us. This will be a continuing series as this program rolls out and it can affect your business. We want to help you. Come join us next month.
So some question and answers today. I'll do my best. It's just going to be depend on what the question is. Yes, ma'am.
You mentioned vision and dental. Are all the coverages going to have vision and dental?
No, ma'am. Just pediatric currently. Just pediatric. And the pediatric on an individual plan is mandated so that any individual policy that's written has to include pediatric. Doesn't matter if you have children or not. Doesn't matter if you're 55 or 60 or not. You're going to be providing that premium towards the coverage of the pediatric vision and dental, which is very similar to maternity. I think this has been talked about in the news here recently. Gentlemen that's age 55 to 60, our ladies that are that age also are still going to be paying for maternity coverage. We fought that battle in the state of Texas many years ago, and were able to get that premium carved out so that it was a scalable premium for expectation. So you may have still been in that window of having a maternity, but your premium, if you're 50, 45 or older, your premium was a lot less. So why they do that, this is cautionary. They've just got to develop premium.
The question about what selection or what elements in the policy that you have, how is that decided? Is it when you sign up? Is there a question and answer routine that you have to go through? You mentioned the navigators. How do I decide what policy is going to be required? If I'm 55 with single, maternity isn't going to necessarily be something I want. However, it sounds like I'm going to have to purchase that as much as the 22-year-old is going to have to purchase pediatric coverage. Is that accurate?
Yes. Am
I hearing that correctly?
Yes, and again, the question is, how do I choose which coverages are best for me? And for right now, the best way that I know to access the information you're asking about from the individual side is to go to the individual open market, not the federal marketplace, since you almost can't get into there. But in the open market, all of the policies that are in the open market are also on the federal marketplace. The only difference between the two sites is the individual health insurance carrier is up and operational, and you can go in to see what your plan is, and you can actually apply for it online. With the federal marketplace, typically what you're having to do at this point is to log in, print out an application, fill out the application. The last time I saw one of the applications, they were somewhere around 24 pages, but my understanding is that they have been reduced. But those applications are asking an awful lot of personal information. Back to your point though, the crux of your question, you really don't have any choice on essential mandates that are inside the plan. Just because one of them does not pertain to you doesn't mean that you're not, that you can buy a plan for less money because that particular piece is not in that plan. You're going to have to go with whatever plan is issued that has those 10 essential benefits placed into it. So what you're looking at that point is, do you want one of the 4 metallic plans? And you have bronze, silver, gold, and platinum. Harris County, I think there's only one platinum plan, and that's offered by Humana. So you've got probably, in each one of the metal categories, you've got maybe 12 plans. Now, when I listen to Health and Human Services talk about it, they go, 4 times 12 is 48, plus that other one's 49, so you've got 49 plans in Harris County. Well, you really don't. You've got 4 categories, and each of the categories, each of the categories has a set plan design that has to be in there. So your maximum out of pocket is $6,250. whatever your deductible and coinsurance is, that's going to be your maximum out of pocket, and then everything else should be 100% coinsurance, unless you're out of network. And most of the plans that we're seeing currently have very narrow or skinny networks. The bronze plan, which is the lowest base plan that you can have, and then the Blue Cross Blue Shield has two of the least expensive plan designs in there. One of those two plans has two hospitals in it. One of them is Memorial Hermann Hospital System, the other one is Tomball Regional. So do you have doctors and other that have practicing availability in a different hospital? Is the doctor you've been going to practicing in Memorial Hermann, or you now have to switch doctors if you want to go to Memorial Hermann? If your doctor is in your network, but he's practicing over a hospital that's not in your network, that's not the plan for you. So you've got to be very, very careful when you're selecting that particular plan on how you view what that particular network coverage is for you. Because all the coverages are the same, and I say that, but if you have one of the HMOs, you may not have some co-pays that some others would have. There's just nuance to it. So you need to be careful. And again, you should, you can research on your own all the time, or you can go to one of your professional insurance agents, brokers, and ask them about it.
Is there going to be an online directory of navigators that are going to be available locally?
Not navigators, no. The navigators are going to be at the toll-free numbers. And navigators you may also be able to find in some of the facilitators that were given contracts by Health and Human Services. And Gateway to Care is a prime example of that. They've got, I think, either 3 or 4 groups that were awarded contracts to train the navigators, of which the navigators only have to do 20 hours worth of training to be able to be experts on talking to you about what you need to be looking at. So, you've got the navigator, certified enroller, you can do chat room online with Federal Exchange, but again, someone who's been trained and has passed all the modules and such for the Federal Marketplace Affordable Care Act, professional insurance agent. And just to carry that just a bit further, every policy that's available right now has commission written into it already. So if you're not using somebody who's trained in the policy that you're wanting to talk about, know about, help you out with if there's a problem, you've just given that money, that commission money back to the insurance carrier, and you've blocked out somebody who could be your advocate.
If I do nothing, what's the penalty?
If you do nothing, it depends on what your tax bracket is, but if you do nothing, typically it's either a minimum of $95 per year or 1% of your family income. Now it's going to go up. 2016, I think that goes up about doubles, and then it keeps climbing again. So really what the Act and the federal government is saying is, we really want you to be here, but we're not going to penalize you too bad. But if you don't start to realize where you really need to be, then we will start charging you, for this. Any other questions?
Yes.
Yes, ma'am.
Some people have called in and said their insurance has been canceled, they don't know why.
Yes, ma'am.
Why would you think their insurance had been canceled?
Because the insurance carriers are having to match up to the essential benefits that are inside as rules and regs for the Affordable Care Act. So any plan after January 1st of 2014 had to either been a grandfathered plan, meaning there was very nominal changes to that plan that would have kept it grandfathered, or they'd have to just replace any plan that was written after that grandfathering period. They've got to go ahead and replace those. So when I hear that those policies are being canceled, it's when the moderators or Congress are talking about it, it depends on which side of the aisle you want it to be heard from. But what the answer is, the insurance carriers are forced to have a have a policy that meets up to certain plan designs. The only way they can do that is to cancel your policy and replace it with a new policy. You may not want the new policy because it didn't do everything you wanted to do, because your network's going to be changed. Your deductible may change. Your coinsurance may change. There's lots of nuances. You may have to be paying for pediatric you didn't pay for. You may have to be paying for maternity you didn't have to pay for. may have been very comfortable because your doctors and all of your hospitals were in your old plan. So, from that standpoint, the insurance carriers are having to do that to be in line with the mandates that are in the Affordable Care Act. From the other side of it, though, while they're losing their plan, they are losing that particular plan, but they're getting a new plan.
One more question. How does this affect seniors who may already be on Medicare and have various supplement policies that they're taking?
I have to be really careful on that one. My wife's a better expert at that particular question than I am, but I'll try to answer it. From a Medicare standpoint, the question is, how does Medicare change from under the Affordable Care Act? What you're going to see from the Affordable Care Act is going to be a reduction in reimbursements to the doctors. And as that reduction happens, you're going to see Medicare losing doctors who are willing to take the Medicare reimbursement. So from that standpoint, again, you need to go back to your annual open enrollment, talk with your insurance agent to figure out which particular product is doing the best for you with the different carriers that are in Harris County. There's not a whole lot of difference on the Medicare side, other than the changes in reimbursement that we know are coming about. Yes, sir.
So the doctor just charges you for the difference. If I'm, Medicare pays, I have a $100 bill, it pays 90, you pay 10.
Yes, sir.
Now Medicare's gonna pay 80 and you gotta pay 20.
Yes, sir.
That's how it's gonna work.
Yes, sir.
So the doctor's not gonna charge you less.
No, the doctor's not going to charge you less, no. Because they're already working on maybe a 3% margin to begin with. Yeah, I'm sorry, it's probably an 8% margin with a 3% net off of that. So, if they get any further reduction from that 8%, they keep practicing
as your copay.
Yeah, and it depends on which supplement you're in. In some of the ways to work around that particular aspect of your doctors being reimbursed is also which Medicare policy, supplement, or advantage policy that you're looking at. Because some of the different carriers will reimburse differently and such, so you can talk with your doctor, ask him who he's happiest with. That's really one of the most effective ways to do that. Yes, ma'am.
Following along on that question, the seniors that are at the poverty level that are now on Medicaid, we've heard since the beginning of this Affordable Care Act that a lot of money was reached in and grabbed out of Medicaid to go into the Affordable Care Act. Is this going to affect treatments and health care for those indigent seniors?
In the state of Texas, it shouldn't, because of the way the state of Texas had their Medicaid set up to begin with. So the cost share, the function of moving the money around, I don't think we would really see that in Texas. Now, again, the state of Texas has a different model than most of the rest of the U.S. does. And I've got to admit, we do have a hole in Texas for the people that are below 100% of the poverty level. The financing mechanism for that is grant money and monies that are shifted back from our taxes back to the feds and back to Texas again. So that's one of those where I'm not comfortable giving you a more definitive answer than that. Sorry. Well, thank you all again. I appreciate being here. Appreciate the questions.